is Sydney Walden, and I did my capstone project on repositioning slings. My practicum hours were completed in the hospital setting on a neurology and epilepsy floor. This floor has 25 beds and can take patients with floor and progressive orders. This floor takes patients 16 years old and above. My practicum hours were completed with the patient care manager of this floor. An interesting fact about the unit that I did my practicum hours on was that the epilepsy patients were scheduled admissions. So they would call ahead and tell the healthcare providers what caused their seizures at home. When they come in, they were hooked up to an EEG monitor, and then we would try to mimic that same environment. So this way we could see what kind of seizures they were having, how long they lasted, and make a treatment plan for them in a controlled environment. The goal of my project is to reduce musculoskeletal injuries among nurses and decrease the occurrence of pressure injuries among patients by increasing the use of repositioning slings and the mechanical lift. This is important because in 2012, healthcare providers suffered more musculoskeletal injuries than construction, mining, and manufacturing workers. According to Liberty Mutual, the largest workers' compensation insurance provider in the United States, overexertion injuries, including lifting, pushing, pulling, holding, carrying, or throwing an object, cost employers $13.4 billion each year. According to American Nurse Today, one estimate suggests that the average nurse lifts 1.8 tons per shift. The 2014 International Pressure Ulcer Guidelines state that the healthcare worker should use manual handling aids, such as the repositioning sling, to reduce friction and shear. Lift, don't drag the individual while repositioning. My learning objectives are as follows. First, perform an assessment on the nursing staff's knowledge of the appropriate use of repositioning slings and the mechanical lift, and assess their barriers to use. Next, develop educational material that teaches about the importance of the repositioning sling and when to put them into practice according to UK's best practice policy. And 3, discuss with my preceptor the data that I've collected from our nursing staff and to positively influence her to enforce the use of repositioning slings on the unit. To implement my project, first, I developed a questionnaire to send out to staff on the unit in order to assess their knowledge, current use of repositioning slings, and their barriers to using slings. Next, I developed a flyer that was hung in the bathroom as part of the potty press and hung in the break room that educated about repositioning slings. I also passed out my flyers to each employee I saw in the hallway just to make sure that I didn't miss any. Next, I sent out the same questionnaire to determine if the staff learned anything from my flyer. And finally, I presented the data I collected to my preceptor. I hope this information will make a positive impact on this unit. This is my questionnaire. Number 1, do you use a repositioning sling on patients who score less than a 5 on the mobility scale? In order to score a 5, you have to be able to ambulate and reposition independently. 2, do you turn and reposition your patients every 2 hours? 3, do you use the mechanical lift when repositioning your patients? If not, how come? 4, do you believe that the use of repositioning slings and the mechanical lift is beneficial for the nurse and patient? These are my results. For question 4, which is do you believe that the use of repositioning slings and the mechanical lift is beneficial, 91% of the nurses on this unit said yes. For question 3, do you use the mechanical lift when repositioning your patients? Only 8% said that they did. Do you reposition your patient every 2 hours? Only 41% of the nurses said they do this. And finally, do you use a repositioning sling on patients who score less than a 5 on the mobility scale? Only 16% said they do this. After sending out the questionnaire again following my education, there was a huge improvement in the answer to question 1, which addressed using repositioning slings on patients who score less than a 5 on the mobility scale. This result improved from 16 to 40%. The results to question 2, which addressed repositioning your patients every 2 hours, also improved from 41 to 60%. I didn't see any improvement in my results to question 3 or 4. For question 3, I received barriers to use from the nurses, which I will go over. And for question 4, I had 91% say they already do this or already find this beneficial, so I didn't expect much improvement with that one. What I saw in my practicum was that the nursing staff did not have immediate access to mechanical lifting devices, and that repositioning slings were not being used according to UK's best practice policy. In my reading, it stated that the mechanical lift should be available to healthcare providers to reposition patients. Repositioning slings should be used on all patients who score less than a 5 on the mobility scale, meaning can ambulate and reposition independently. The nurses stated that due to working in an older part of the hospital, they do not have access to ceiling mechanical lifting devices. They instead have a portable device that is large and bulky and shared with their entire floor. They have semi-private rooms, meaning they're shared by multiple patients, and they don't have room to bring the portable mechanical lift in. So imagine it's a small hospital room, 2 to 3 beds. Not only do you have the patient in their large bed, you have their family, their belongings, and these portable lifts just are not practical. The nurses expressed a desire for the ceiling mechanical lift to be installed, and they said if they were readily available, they would use them when repositioning their patients. So when to use a repositioning sling based on UK's best practice policy. The repositioning sling needs to be a part of the bed makeup for any patient that scores less than 5 on the mobility scale or cannot turn independently every 2 hours. The repositioning sling should be attached to the ceiling every time you need to turn these patients or move them up in bed. I spent my practicum experience shadowing a patient care manager. Throughout my time this semester, I was able to sit in on interviews for potential new hires and give my opinion. I was also able to go to manager-only meetings that address staffing in the hospital I currently work in. This was a huge opportunity and opened my eyes to what goes on behind the scenes and showed me how hard my own manager works to staff my unit. I was also able to listen in as the manager handled conflict between staff members. And these are my references. Thank you for listening.